Something else we look at are characteristics of the pathogen. What's its virulence? What is the ability it has to cause disease? How good is it at adhering or penetrating the host cell, thwarting immune defenses, damaging the host? Does it have fimbriae? Does it have a capsule, etc.? What's the dose? This is the minimum number of pathogens required to cause an infection. Doses below the minimum might actually produce asymptomatic infections, but the immune system can actually eliminate it before the disease progresses. What is the incubation period? This actually impacts how quickly it spreads. If it's a short incubation period, it won't spread very far, but if you have an extended incubation period, you can get a lot of people being infected before they even realize that an outbreak is happening. What's the characteristics of the host? What's the immunity to the pathogen? Have you been exposed to it before? Are you immunized? Remember, herd immunity protects individuals who haven't come in contact because there's so few people that aren't protected, the disease can't spread. Typically with herd immunity, you're shooting for more than 90% of the population being protected. However, you can have evolution occurring in the pathogen where they have antigenic variation, which allows them to bypass the immune system. What's the general health of the population? Is there malnutrition? Is there overcrowding? Is there fatigue? What's the age? Typically, the young and the very old are more susceptible to disease. What's the gender? When you look at things like urinary tract infections, women have shorter urethras, so they're more susceptible to that sort of disease. What are the religious and cultural practices? In cultures where breastfeeding is acceptable, it actually provides more antibodies to the infant that can help protect them. In other cultures, you consume raw fish, and that can actually increase your exposure risk to certain pathogens. What's your genetic background? Some people just have better genes, and they have a better immune systems. You also need to look at characteristics of the environment. What's the temperature? How much water is there? What's the nutrient supply? Is there light and oxygen? Crowding and poor sanitation can affect the environment. If there's endospores being produced, remember they can survive even when the environment goes south. And is there a risk of exposure to antibiotics? So when you're doing epidemiological studies, this was actually first done by John Snow. Remember, he documented the cholera epidemics that happened in London due to contaminated water supplies. And he actually started collecting data to realize what was happening. So typically with these, you do descriptive studies. You actually need to collect data after outbreaks. You need to look for the person. You want to know things like age, gender, ethnicity, occupational habits, illnesses, socioeconomic class, marital status, because that can give you clues about risk factors. What's the place? You need the geographic location to pinpoint the source. It can actually help you figure out potential reservoirs and vectors. What's the time? The season's important, also the rate of spread. Is it spreading quickly? Is it spreading slowly? Because if you have a rapid rise in the number of cases out of nowhere, it might be a single source, where if you have a slower increase in cases, you might be dealing with something that's a contagious disease. Now, a lot of times you also want to do analytical studies where you're looking at the relevancy of risk factors. So you do these double-blind case control studies to identify the causative chain of events that led to the disease. You survey a range of people trying to figure out what the different risk factors are, and you typically do this with cohort studies that have known risk factors or exposure to risk factors. You're trying to judge the cause and effect relationship of risk or preventative factors. You can do things like compare treatments, new treatments with known treatments, or you can compare things against treatments and placebos. Now, in terms of disease surveillance, we actually have the National Disease Surveillance Network run by the Center of Disease Control. They also publish the Morbidity and Mortality Weekly Report. So what you guys might not realize is that public health departments in every state have to report certain diseases to the government, and they can also mandate that certain diseases within the state are reported to them. That's how we can respond quickly to outbreaks of things like E. coli and romaine lettuce and listeria and bluebell ice cream. Also, if you have high numbers of absence rates in like high schools, schools have to actually report that to the public health network. News media is also required to alert the public when outbreaks are happening. We also have the World Health Organization. This does worldwide disease surveillance, and it has four main functions. It helps to provide worldwide guidance in the field of health. It helps to set global standards for health. It helps to cooperatively strengthen national health programs, and it helps to develop and transfer appropriate health technology. So the World Health Organization provides education and technical assistance, and it provides information through things like journal articles and books. So when you're trying to reduce and eradicate disease, a lot of times this has been done through things like improved sanitation, reservoir and vector control, vaccination programs, but smallpox is the only thing we've actually been able to get rid of. We are working on measles, polio, and the guinea worm, but we are not successful in that. And I can't pronounce that word. I'm not going to, that's the fancy medical term for the guinea worm. That is probably the next one we will eradicate. There were less than 3 cases in the last couple of years. However, we do have new emerging pathogens, and we do have resurgence of infectious diseases. So when you're looking at things that are emerging, these can be new or newly recognized diseases, things like MERS, SARS. You can also have evolution in bacteria where they have new genes and new pathogenicity factors. That means that previous ways we control them don't work anymore. And there's lots of different factors that contribute to whether things are emerging or re-emerging. Things like changes in technology, how quickly we can move around the planet, climate change, war. All of these factors can impact the spread of disease. We also have healthcare-associated infections. These are acquired when you're getting treatment in healthcare settings. These are one of the top 10 causes of death in the United States. And these hospital-acquired infections are problematic historically. Remember, if you're in a hospital, you're usually immune-compromised to begin with because there's something wrong with you. So the people who are most susceptible to getting sick are around those who are the sickest and most likely to spread disease. This is also where you see the evolution of a lot of resistant pathogens. And it's estimated that 5 to 10% of patients in the United States will acquire one, and about 2/3 of them come from the patient's own microbiota. Now, there are reservoirs for infectious agents in hospitals. Other patients, right? Other patients can be discharging things. The healthcare environment itself. Gram-negative rods are really good at surviving in the environment in places like sinks, respirators, toilets. They're really good at staying on fomites. Things like Pseudomonas can grow in disinfectants. And some of these infections are actually linked to things like contaminated soap. The healthcare workers themselves can be sick or carriers,